a sealant? It is an organic polymer resin. It is a resin, okay? It's a polymer because it's composed of two different monomers. Don't need to know that, but that's what makes it a polymer. It's organic because it's produced by natural things, so to speak, okay? So, what we do is, in order to get mechanical retention, we etch the tooth. We want to get that frosty look and put the sealant in there. So sealants are held in place by mechanical retention, okay? The organic polymer is diluted with something called bis-GMA, or there's something else out there, write it down, called UDMA, in case you ever hear it, UDMA. Bis-GMA is that two-part polymer thing. It's bisphenol A glycidyl methylmethacrylate, okay? And that's the long name for that. So we usually say bis-GMA, but if you see this name, you know that it is. So we have filler particles usually, which are glass, porcelain, and quartz that mixes with this polymer that makes a sealant, okay? So that's usually what makes the sealant. The particles makes the sealant hard so that it has some abrasiveness to it, so it doesn't wear down as quickly. So the idea is to seal off that pit, okay? And when it's cracked or worn away, there's usually some sealant material still in there that you can't see. So even if you lose the top part, you usually have it in there. Do sealants last forever? No, they do not. But they usually get you through those cavity-prone years. And that's the goal, is to get Johnny, who's chewing on all those gummy bears and stuff, until he's, 12 or 13 and realizes, oh, I said Johnny, isn't that funny? That Bobby, let's use Bobby. That people don't like to look at gummy bears in their teeth, and they're a little more concerned with their oral health. Okay. It's also to prevent oral bacteria from collecting within. Okay, so the purpose of the etch, as you know from adhesive, was to produce micropores. Hint, hint, it is in bold. I probably would want to know that. So that allows the sealant to go in there and cause what kind of retention?
Mechanical.
Mechanical, great. Okay, so there it is. It's going down in this fissure that we can't see, and that's going to seal off that tooth and prevent it from getting caries. What tooth is usually the first one?
I was literally going to say the first molar.
Very good. TDK is the first molar, okay? That's 6-year molar. Why?
They come in first.
It's the first adult tooth to come in, and where is it?
On the lower right.
Way behind all those baby teeth. And does Mama know that it's a permanent tooth?
No.
A lot of times, no. Remember that from anatomy class?
I do remember that.
Yeah, we talked about it before, didn't we? Yeah, I remember. Okay. So during sealant placement, we may trap bacteria if we don't have 100% contamination free. But it's okay, because we're going to smother it, okay? Some teeth with incipient lesions could be sealed. An incipient lesion is found where? Enamel only, okay? So we can usually seal that and arrest it, but we can't go any further into the dent and we're dead. We have to do a restoration, okay? So very small incipient lesions can be sealed. And a lot of times doctors will use the not the air polisher, but the air abrasion to clean those out. Okay, so chances are caries is not going to grow underneath. Yes?
Is that the micro etcher? Is that the same thing?
The micro etcher? Yeah.
Okay.
Is that what you have in your office?
Yeah.
They may even do a fissurotomy, or they just line the fissure with a burr, just to make sure.
Okay, so who are the ideal candidates for sealants? Of course, dry mouth, because if you have a dry mouth, you're not self-cleansing with saliva. Ortho, because getting in there and clean braces is difficult for kids. Poor oral hygiene. High caries anyways. As somebody could have high caries and have great hygiene, what would cause the caries if their hygiene was good?
DNA or genetics. Like genetics maybe from the parent.
Or systemic.
Diet.
Diet.
That one.
That would be the number one. Those others too, but diet. Okay, they brush like crazy, but maybe they have a real acidic diet. You know, they're drinking Gatorade all day long or something like that. So that kind of thing. Okay, incipient lesions. We said if they're in an area that does not have fluoride in their water system, this is good. And any deep anatomy we want to take care of. So when do we not? When we definitely see that there's caries, okay? If we see interproximal caries, we don't want to mess with the sealant, we want to do the restoration. Let's move on. If some people have beautiful teeth with wide pits and fissures, and they're not deep, and they're gorgeous, well, you don't need to seal those because they can clean them, okay? And if they happen to be that person that has that low caries risk anyways. Okay, so you use your little flow chart. Is there a pit and fissure sealant? The answer is no, but is the carie risk high? Yes, then we probably would seal it. If it's deep, no caries risk is a no, then we wouldn't seal it. So it's common sense. This one, is the pit and fissure deep? Yeah. Is there proximal caries? Yeah. We restore it. No, we seal it. Is there incipient? No. We seal it. Yes, we can seal it. So I love that little flow chart because I think it's very explanatory. Flow charts are great, aren't they? Okay, so the types of sealants are filled, unfilled, chemical, fluoride releasing. A filled is the resin with the filler particles in it, quartz or what have you. Okay, there is unfilled, that's what we used to use, and it's clear, but it wears really quickly. There's not a lot of unfilled sealants out there anymore. Most of the sealants are filled. But originally, it was unfilled, it was clear, you couldn't see the stuff that you were putting in there, you had to go with the feel. It was a mess. Chemical cure means you put a light on it. Or chemical cure means you mix part A with part B, or you put a light on it, and some of it's fluoride releasing. So chemical can be two. It can be part A and part B to polymerize it, or you put a light on it to polymerize it. Okay, self-curing is another way of saying it cures itself. It's what we used to have was we mixed a part A, a drop and a drop, mixed it very quickly, hope we got it in the tooth before it set up, and we were good. That was all we had, okay? And you had to work very quickly, but you didn't need a light to cure it. Now, what was wrong with it? Hot, humid days, hot mouth, trying to get it in there before it's set up. It's a problem. Is it good for when you're going out in urban areas? It is, okay? Because it's better than, because you got, if you're out in wherever, a poor area and you're trying to do a sealant day with children, sometimes that's all you got, okay? Or if you're in a school. So the advantage is no special equipment, which helps us out in those situations. It's just not the best, okay? Sometimes we get bubbles when we mix part A and part B, and you gotta work really, really And that's what we like. We'll show you how to use the light in the clinic when we get there. And that gives you more time to get it in there, and then you can cure it. Curing depends on the intensity of your light. So like with this one, it's usually 5 seconds, 10 seconds, 15 seconds, 20 seconds. We usually just, this is the power on, and this is the number of seconds, and then it beeps, beeps, you know. So 20, you know, if you got 20, you've really sealed the thing. It's hard as a rock, okay? With this particular light, every light is different, okay? I don't know what the output is of your lights, but that's what you need to check. So it gives you a lot more working time. The disadvantages, I don't feel are a disadvantage. Extra cost, of course, but it's worth it. And you have to disinfect it, but it's worth it, you know? Do you have anything you wanted to say, Ms. Heaton? Okay. Classification by color. We have clear, we have tinted, and we have opaque. So what we use here at Sinclair is something called ClinPro. And our ClinPro, when you put it on, I'll pass it around. When you pass around our ClinPro, it is pink when it goes on, and when you cure it, it turns white. So that's what I like about this stuff. It has that visual for you, which I think is great for new learners. Okay, not all of them have that. Most of them they go on white and cure white. And we went through this phase one time. Remember that? Oh my God! Did you? We went through a phase where we had green, blue, pink, yellow sealants, and we would ask the kid, "What color would you like?" And they went green. And then when they were 12, oh my God, I picked green.
Oh, so they were actually colored? They didn't turn white? Lord have mercy.
They were colored.
You're kidding.
Somebody thought that was a cool idea, and it was a loud. It's a cool idea when you're 6. Not so cool.
Yeah, I was getting black and silver.
Yeah.
Yeah.
Okay. So the goal for sealant is mechanical bond. Okay. If you lose it within the first 6 to 12 months, it is operator failure. You contaminated it. Okay. Operator failure. All right. So what teeth do we want to pick? We want to pick newly erupted teeth, and they need to be fully erupted. So your 6-year molars have to be fully erupted. Your 12-year molars have to be fully erupted. Those are the 2 most popular teeth that you seal. You know, grab yourself a 7-year-old, throw them in the chair, get that sealant on there, protect them. They'll thank you for it.
Later on they will.
Yeah. Look at the occlusal contour. We do third permanent molars, not often, because you know what year did they come in?
17, 18.
19, 20, 21, yeah. Okay.
And insurance usually doesn't cover it.
Yep. But we're looking at the occlusal surfaces, that lingual pit on maxillary molars, and the buccal pit on mandibular molars. Do not forget those pits. Okay, it's not just all about the occlusal. We have sides to our teeth that need attention.
And if they have a custom hair belly.
Oh yeah,
Oh, the custom hair belly.
yeah,
Remember that?
yeah. On what cusp is it on?
Maxillary first molar.
Uh-huh.
The fifth cusp. I know what tooth it's on.
But what cusp is it on?
It's the fifth cusp, because it's the fifth one.
Well, what does it?
Where does it?
Lingual.
Huh?
I don't want to answer. Mesiolingual cusp.
Mesiolingual cusp.
Thanks,
Does
Justin.
anybody have one?
Yes.
I think I do too.
I think you do.
Maddie, you do.
See, all these things that you learned the first semester is coming back to haunt you.
It just comes back.
Oops, what's going on here? Okay, so we do some premolars, but most premolars don't need it because they're self-cleansing because they're so close to the mouth. We do in pedo, sometimes they do first and second molars in pedo, but they're exfoliating by 11, you know. But some pedo practices do that. Okay, when you are doing your sealants, do not do 4 quadrants at once. Do 1 quadrant at a time so that you can be efficient. You can be efficient and fast doing 1 quadrant at a time as opposed to throwing cotton in a poor little kid's mouth and trying to do all 4, because all you're doing then is fighting with them because it feels so horrible. So if you do that to anybody, I'm going to put you in the chair and I'm going to do the same thing to you. Okay? So I don't want to see.
You'll put the amount of cotton rolls I put in.
The Hebe Hop cotton roll.
Yeah, I'll do Hebe Hop cotton rolls too. In all 4 quadrants. Okay, so really, you want to just be methodical. I do I usually do the top, like a maxillary first, because it's easier on them. And then you buy their trust, and then you go to the mandibular, because it's, yeah, you want to buy their trust. And so we just say, okay, I'm working on the top, now we're going to the bottom, close, rest, you know, that sort of thing. Okay, moisture control is important. Isolation, the tooth has to be sufficiently erupted, or all we do is get gooey stuff out of the sulcus. Proper etching and no contamination from the time of acid etching to the cure of sealant. There are times when kids just can't stay open, so this is what I do. I take a cotton roll, I cover up my tooth so they don't contaminate it, close, and then I let them open and they're going to cooperate with me, okay? But it's got to be covered completely, especially if you acid etched it. But I find that really helps a lot. Okay, close and relax, and they're a happy camper. Okay, so we have to prepare it. So we're going to do that either with the air polisher, okay, or we are going to do it, we are not going to use air abrasion, but a doctor may, or we're going to pumice it. So today we're going to fake our pumice, but this is pumice. And they're called Preppies, and you'll find them in the dispensary in the bottom by those cabinets.
Yeah, with all the other little green tubs.
Yeah. So grab a Preppy if you're going to polish it. Today we're going to fake polish, okay? Because we're going to fake polish the Typodont teeth, because we don't need to use pumice, waste pumice on that, make a big mess.
You can also use that for patients that don't want any fluoride whatsoever. That's just a flour. Or if they have a really bad stain, just let your instructor know, because you can apply that to your cup and get some of that darker stain off with that stuff too.
Yeah, because it is more abrasive.
But if you're using the air polisher, which one are you gonna use?
For air polisher, you can use
You would use
Sodium bicarbonate, yep, so the blue one.
The blue one. Sodium bicarbonate is what you want to use.
So plan your day out, like if you know you're gonna have sealants, get all that ready. And then when you're done with it, get it over to DSL to someone who you want to use it to, because it's gonna take you like 2 seconds to get 14 polished, okay?
Yeah. So this is a Garmer. This is that cotton roll holder I was talking about. And this part goes towards right the midline. That's how you know right from left. But you slide it on. You see those little pokey things, and if you don't get them just right, then you have to clamp it under the chin, and I don't know, sometimes they don't like it.
Yeah.
So with your air water syringe, before you go to the tooth to dry it out, always go to the side and go, hit the air. So do you get the oil out of it? So there's no contamination with oil. Really watch the tissues. Get that high speed right there to suck up that etch so that this patient doesn't taste it. Once they taste that sour, you lost them. It tastes so bad, I'm gonna die.
or it hurts. It may hurt.
It may hurt,
My
or
it burns.
it's gonna burn the tissue,
Mhm.
and that does hurt.
Yes.
So,
I always tell them I'm putting soap on their teeth to make them super duper clean. Don't touch it with your tongue. But sometimes when you say the T word, then the tongue just grows 5 times, and you're like, okay, never mind. And sometimes these aren't candidates, guys. It's okay. Like, if you can't get it dry, don't even try it. Be like, you know what? Don't make it a bad.
Yeah,
habit.
sometimes it is better, so if it doesn't work the first time, just to bring them back and things go better. Now, there are newer sealants out there that work
In wet.
in a wet mouth. And those, that's what you want to have on hand for that nasty little patient. And I don't know the name of it.
Are they as effective as a normal sealant?
You know, I don't, because I have not used it. But I do know it's out there. Can't talk about efficacy.
Yeah, but it's more hydrophilic.
Yeah, so they are out there. I want to get some though, because I want to try it.
I'll look it up.
Okay. Yeah, so be careful not to let them taste that sealant or burn. Okay, again, we don't want them to go crazy. 37% is what we usually use, okay? There used to be liquid, that was a clear drop. That was horrible because your chances of getting it in the mouth, on the tongue or something was high. So now we have gels. So we have gel. First we have gel. Okay, and they come and they're blue. Our gel is blue. Okay, and you can see it. So it's a gel or a semi-gel, and you can see it, what you're doing. Now, everything comes with a cap on it. So the white cap goes on the sealant, or the etchant. The blue dispensing tip, think blue. The sealant has a black tip on it, as that was going around, or it has a black cap and a black tip.
Why do you think that is?
Huh?
Why do you think it would be black? Because you have to cure it. So these,
Smart
if you leave,
thinking.
so if you leave these uncapped and open, you may ruin your material.
Okay. Good job. Okay, so you want to etch 15 to 30 seconds approximately. If you're using liquid, you're using a little cotton ball and you want to dab it, not rub it, because you don't want to break the enamel rods. But Jen, you want to just go just about 2 to 3 millimeters beyond where you're sealing, but not anymore. You don't want it all over the cusp. Okay. And so there we put it on, and it's a, if your blue is light, dark, that means you have it not thick enough in one area and too dark in the other. Keep the viscosity the same. So you want to get that, you want it to be a dark blue, you just don't want it to be all over the place. So you want thickness, but not width, so to speak.
Choose your pin and your fisher.
Okay, so this one we've used that picture again. On your teeth today, the type it on, it's not going to get frosty for you. Unfortunately, you're not going to see that. But we're going to etch them anyways, okay? But they will not get frosty. If it does not get frosty, you have to re-isolate and start all over again, okay? So something happened, they put their tongue up there, or for whatever reason, it just did not etch.
So the blue was the etching, right?
The blue is the etch.
And then you rinse it and then it becomes white and chalky
White, yes.
Once you dry it.
once you dry it. Okay.
And before I dry it, if this cotton roll is wet, what am I carefully going to do? I'm going to carefully remove that cotton roll and put a dry cotton roll in there before I dry it. Otherwise, what if I dry it with that wet cotton roll there? I get water all over the place. Okay? Okay. So, yeah.
If you do have to re-etch, you don't have to do the full 15 seconds. You could do 10 because you've already etched that too. You don't want to etch it too long. Does that make sense?
Okay, so you want to avoid overfilling. With this sealant, a little bit goes a long way. Once you cure it, it expands. So be careful not to put too much in there because it does expand and then you have to adjust it, okay?
we have little micro brushes in your kits, so if you need to wick some out, like if it comes out in a big pool and you just see a big pink, you'll want to drop your micro brush in and try to draw that out, because you don't want to try to push it. That's when you create voids and bubbles.
It's the quicker picker-upper. Okay. All right, so we want to avoid manipulating. Cure about 15, 20 seconds. Don't look directly at your light. Look away because you don't want to burn your retina. Hold the tip about 2 millimeters. Do not touch that tooth. If they say it's hot, back it off to 3. Okay? And that's a beautiful sealant. Hebe Hob probably did this sealant. I'm pretty certain.
I don't know, I would have sealed that class 6, but. Yeah.
Oh yeah. Oh yeah. All right.
Look at her.
Yeah. Here I'm trying to give her a
Looks great,
compliment.
and
I'm
then-
just kidding.
Didn't work. Really, Mr. Elsevier put that in there. So anyways, that's what you want. See how it's not on the inclined planes and all that stuff? That is what you want.
So you may have to squirt a little bit out to get the feel of the flow before you go in bare and it goes everywhere, okay?
Oh,
Also, with your curing light, like she said, don't put it directly on the tube because some materials will be drawn to the light and you'll actually pull them up off of your tube.
okay, so this is a nice sealant, but they forgot to do the oblique, or the, on the other side of the oblique ridge there, so you want to make sure to get that as well. That lingual groove.
And the cusp of Carabelli.
And the cusp of Carabelli. Okay, see right there? Look at that. You want to do that too. Okay, and then you want to evaluate it. You want to take your Explorer, and it's a shepherd's hook, and you're going to feel from submarginal areas or voids, and if nothing's contaminated, you can add to that and cure it again. Otherwise, we might have to start, if it dislodges, you want to try to, you don't want to pull as hard, but you want to try to dislodge it. If it dislodges, it dislodges. You got to start over. Okay, you want to, once you're done, you do want to wash it off because the plastic has a bad taste too, and kids don't like that. There is an air inhibited layer that does not cure because we don't have what's called a mylar strip over it. So it'll feel sticky. Just wipe that off with a wet cotton roll. Okay, now, please evaluate the contacts in case some sealant went in there. There's no etchant in there, and you will, if you accidentally sealed them, you'll be able to get that out easily, okay? And then you want to check the bite. So this is a Miller's forceps. This is how you put the marking paper on it. This goes towards the cheek, tap, 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 goes side to side. Open. You want to look for heavy spots on the sealant or halo spots on the sealant, and you need to reduce it. So I do that on my maxillary tooth, and gee, I'm good. Then I do it, then I'm going to do the mandibular. So I want to check the bite down there. But what do I want to check again, just in case? Yeah, because now you're messing with the mandibular. You could have, you could be hitting on the top it's possible.
And you want a give and take relationship anyway, so if one's really, really high, you want to reduce that, but you want it to be even throughout, so.
And to get it even is to hear, I like to listen. You can hear how teeth sound, and I put my ear down there and I listen, and if I hear that thud, thud, ooh, something's not right, okay? So start going like this so you know what you're listening for. Got it, Johnny? Can you hear it?
Yeah, mine's kind of a thud, because I have blue bites.
Oh, you have?
Yeah. Because think about it, Molly, where does your lingual cusp of your maxillary, or lingual cusp of your mandibular sit into? So your lingual cusp sits into your maxillary central pit, right? So
She-
that's what's gonna hit.
Okay. Drying, make sure you dry the quadrant before you put the articulating paper over it. Again, look for the blue or halos. It's good to ask the patient about comfort however they lie. How does that feel? Feels great. Okay, let me check it. Maybe we'll do a little adjustment anyway, okay? They want to get the heck out of Dodge and get to that toy box. So, anyway. You can't believe kids, right?
And sometimes they turn into a class 3 overnight. You bite down, you're like, so tell them to put the tip of your tongue on the roof of your mouth as far back as you can. It will draw the mandible back, and they'll actually bite where they're supposed to bite.
So, again, we don't want to go here on inclined planes, so please don't do that. Okay, we'll be here all night getting that off. You can go in with a 2, 4, or a 6. We start with a 6 round, and as we go deeper into the pit, if it's still hitting, we get to a smaller burr because you're not getting to it. Okay, and we'll smooth that out. I don't want to go in reverse.
I'm okay with that.
Sometimes, as when we first would teach you, you'd be a little bit scared, so we would go in reverse, and
Takes forever.
it takes forever. I just want to go for it.
So your video that you'll watch may say.
Say, put it in reverse. We're not going to do that. We're just going to go for it.
Why not?
That's right. So, this is in review. Clean it, dry, isolate it and dry it, etch it, rinse it so it looks frosty, place it, polymerize it, check the coverage and retention, wipe the air inhibited layer, check occlusion and floss. Okay, what if it fails? We're almost done. What if it fails? Saliva is the main source, moisture. Sometimes if you don't get the etchant off, you'll get like a reaction between, you'll get a calcium phosphate products react, and you'll get backed. It won't seal. Okay, so you want to make sure your etchant is rinsed. And then fluoride. If you you have your patient in a chair, you give them a fluoride give them a fluoride treatment. Doc comes in and says, hey, why don't you seal these teeth? I can't, I gave them a fluoride treatment. But if you think you're gonna do sealants in your operatory, you would do it first and then the fluoride treatment. Put the caps on when you're done. Wipe them off with a Cavi wipe or Omni wipe or whatever the heck wipe we have here today, this week, okay? And keep them in the refrigerator, okay? So these will be found in the refrigerator. And the shelf life is usually about 18 to 36 months on that. The Blue Book. So, the clinic dentist has to pre-authorize it. Some of them want bite wings, some of them don't. It is what it is. Just ask them, do you want to see bite wings? Okay, so we put our patient, their age, the tooth, and the surface, okay? So if it's 3 occlusals, comma, buccal, or whatever, or lingual, the date and the pre-approval will be the doctor's initials. The hygienist, your pod, will put the date that you put it in there. We'll put that date there. They will check it for you, and they will put their initials there. Pre is dentist initials. Post is pod faculty initials. You have to do 10 permanent molars because realistically to do all premolars is not realistic. It's not a realistic test. Patients must be 18 years of age or younger because we want them to move around a little bit because that's realistic, okay? Fall semester, we want you to get 5 permanent molars, so be on the lookout, okay? And then you can't do it on each other. You can't do first-year students. And sealant candidates don't have to have a prophy in our clinic to get sealants done because it's so hard to get patients, so we say, hey, if you can abduct a kid off the playground, go ahead.
That was good. I like that. That was really good.
Just kidding.
I am just kidding. I hope this place isn't mine. If you see me walking out the door in cuffs, you know I screwed up really bad.
Coach is gonna come around the corner like, what did you say?
All right, well, you catch my drift.
Yeah.
All righty.
Yeah, this is what they teach us.